Hi friends, welcome to the channel The Nurse. Here we are discussing about JIPMER Nursing Officer Exam memory based questions and answers. It was conducted on 4th of September 2022. Now we will discuss around 40 questions that we have got it from through our WhatsApp channel and through our YouTube channel community tab. So we will discuss these questions. So it will be memory based questions only. So there will be a mistake. The exact questions I have changed to make a proper question I have made. So some changes will be there. So kindly cooperate. So we'll go to the questions. JIPMER Nursing Exam 4th September 2022 memory based questions and answers. First question. When should the WHO's labor care guidelines be initiated? The correct answer for this question, it should be initiated during active phase of first stage of labor. Active phase of first stage of labor, that is 5 cm or more cervical dilation regardless of parity and membrane status. So WHO's labor care guidelines is to be initiated during the active phase of first stage of labor, that is 5 cm or more cervical dilation stage. Second question. Signs and symptoms of impending septic shock. Signs and symptoms of impending septic shock, that is hypertension will be there, cold, clammy and pale skin will be there, changes of mental status. These are the initial signs and symptoms of septic shock, impending septic shock. So any of these options is there in your question means you can make the correct answer. That is hypertension or cold, clammy and pale skin, change of mental status. These are the initial symptoms of septic shock. Next question. In which electrolyte imbalance the insulin with the dextrose solution is used to manage? Correct answer, hyperkalemia. For the management of hyperkalemia, we will use insulin dextrose solution. And other methods used in hyperkalemia management includes salbutamol nebulization, K-bind enema, or in extreme condition, administration of injection furosemide, that is Lasix injection. So these are the main management technique used in hyperkalemia. Insulin with the dextrose, salbutamol nebulization, K-bind enema, or in extreme condition, injection furosemide or Lasix. Fourth question. While administering injection morphine, what will be the priority monitoring? Correct answer is respiration. Morphine sulfate is an example of natural opioid used for the severe pain management. Respiratory depression is the common complication associated with morphine overdose. So we should monitor the respiratory status. Next question. If patient receiving injection furosemide, the nurse will advise to take food rich in which nutrient? Correct answer, potassium. The main side effects of injection furosemide or Lasix injection, that is hypokalemia. To prevent hypokalemia, the nurse should advise the patient to take potassium rich foods. For example, the common side effects of injection furosemide is hypokalemia. So the nurse should advise to take potassium rich foods such as potato, white beans, banana, etc. Sixth question. The relation between digoxin and potassium. The relation between digoxin and potassium, that is hypokalemia causes or worsens digoxin toxicity. So we should monitor the potassium status before giving digoxin, because hypokalemia worsens the digoxin toxicity. Next, what is glossitis? It is a direct question. It is inflammation of tongue. Glossitis causes tongue to swollen, change in color and develop different appearance on the surface. Glossitis causes tongue to swollen, change in color and develop different appearance on the surface. Next question. The technique used in the delivery of shoulder dystocia condition. The technique used in the delivery of shoulder dystocia condition. Correct answer, McRoberts maneuver. McRoberts maneuver used in shoulder dystocia condition. Other techniques includes Wood's maneuver, extraction of posterior arm, and cleidotomy, and last one, Zavanelli maneuver. So these are the techniques used in the shoulder dystocia. Next question. In post-op period, lower lobe rales associated in which condition? In post-op period, lower lobe rales associated in which condition? Correct answer, atelectasis or lung collapse or fluid overload. In that condition also, rales can happen. Atelectasis, lung collapse or fluid overload. In these conditions, rales will be there. 10th question. How many doses of fractional IPV vaccine to be administered according to the Universal Immunization Programme? Correct answer, 2 doses. A schedule of fractional intradermal doses administered at 6 and 14 weeks ensures early and appropriately timed protection. The 2 fractional doses should be separated by a minimum interval of 4 weeks. So, minimum interval between 2 doses of IPV, that is 4 weeks or 1 month. So, it should be administered during the 6th and 14th weeks of birth, and it replaces the earlier OPV doses. So 2 doses is required for IPV, that usually administered in 6th and 14th weeks. The minimum gap between 2 doses is 4 weeks or 1 month. Next question. What is the common cause of neonatal death in India? Common cause of neonatal death in India, that is low birth weight. Next question. What is the common causative organism of bacterial endocarditis? Correct answer, Staphylococcus aureus or group A beta hemolytic streptococci. Any of these option in your question means you can make it. Either Staphylococcus aureus, usually the first reason for bacterial endocarditis, that is Staphylococcus aureus, then group A beta hemolytic streptococci. 13th question. Distended jugular vein is seen in. Distended jugular vein is seen in right-sided heart failure or congestive heart failure. Usually in fluid overload, the jugular vein distension will be seen. 14th question. The principles of pulse oximeter. The principles used in pulse oximeter. Correct answer, the Beer-Lambert law, that is relevant to pulse oximetry, a monitoring technique that works on the basis of spectrophotometry. I think you got an option that Lambert law. So correct answer is Lambert law. The principles of pulse oximeter, that is works on Lambert law. The basics of Lambert law, that is spectrophotometry or photoplethysmogram. The basis of Lambert law, that is photoplethysmogram or spectrophotometry. In your option you got that Lambert law. So the correct answer is Lambert law. The principles of pulse oximeter, that is Lambert law. Its full name is Beer-Lambert law. Next question. The granulation tissue formation takes place in which stage of wound healing? Correct answer, proliferation stage. In proliferation stage, granulation tissue forms. Under normal adult condition, wound healing and tissue repair occurs in 4 stages. First one is hemostasis. In hemostasis, the scab formation will be there. Second stage is inflammatory stage. In inflammatory stage, there will be inflammation and edema formation. Then third one is proliferation stage. In proliferation stage, granulation tissue formation. Next question. What will do if tachycardia develop during suctioning? Correct answer, withdraw the suction catheter and oxygenate the patient. Because tachycardia may indicate compensatory mechanism to the hypoxia that is caused by suctioning. So we need to oxygenate the patient. Next question. What is abruptio placenta? That is premature separation of placenta from the uterus before the birth of baby. Next question. Vaccines administered at birth. Usually OPV and BCG. I think you got an option that hepatitis B also. So hepatitis B also can be administered during the birth or within 4 weeks. Next question. The probe used in E-fast sonography assessment. The probe used in E-fast sonography assessment, that is curvilinear probe. The curvilinear probe is used in E-fast sonography assessment. E-fast, that is extended focused assessment with the sonography in trauma, is a bedside ultrasonographic protocol designed to detect peritoneal fluid, pericardial fluid, pneumothorax and or hemothorax in a trauma patients. I think it is first introduced in trauma center of AIIMS. So later it is used in all of the Indian hospitals. E-fast, extended focused assessment with the sonography in trauma. Next question. Mirror therapy is used for. Mirror therapy is used for improving motor function after stroke or people with amputated limbs. So any of these option is there means you can mark this option. So in improving motor function after stroke or people with amputated limbs, in both conditions we can use mirror therapy. In mirror therapy, a mirror is used to create a reflective illusion of an affected limb in order to trick the brain into thinking movement has occurred. So usually a mirror placed between, if the arms are affected, the mirror is placed in between two hands and the brain will think that mirror image that other opposite hand, that is weak. So while moving the unaffected hand, the image also will move like that opposite hand. So that is the mirror therapy. Next question. What is resilience? Resilience means capacity to recover quickly from difficulty. Resilience means capacity to recover quickly from difficulties. Next question. An elevated alpha-fetoprotein in pregnancy indicates, that is risk for neural tube defects. Elevated alpha-fetoprotein AFP in pregnancy indicates risk for neural tube defects. Next question. Position used in abdominal examination, that is in supine position with leg flexed. So abdominal muscles will relax, so we can do the abdominal examination. Supine with the leg flexed position, the abdominal muscle will be relaxed, then we can assess the abdomen easily. Next question. Lufthansa Airlines belongs to which country? Correct answer, Germany. Next question. Where did Arikamedu Settlement found? Where did Arikamedu Settlement found? Correct answer, Kakkayanthop, Ariyankuppam, Puducherry. Arikamedu Settlement found in Kakkayanthop, Ariyankuppam, Puducherry. Next question. When should switch rescuer during the CPR? When should switch the rescuer during the CPR? Correct answer, after 5 cycles. So 1 cycle, that is 30 chest compression and 2 rescue breath. So after 5, 30 is to 2 cycles, the rescuer can change. Then next question. What is epigraphy? Epigraphy means the study of inscriptions, that is usually in the ancient times. So usually in ancient times there will be written in leaves and stones. So the study of inscriptions in that ancient times, study of inscription is known as epigraphy. 28 question. Drug of choice in hypertensive crisis, that is nitroglycerins, that we can use in the condition of hypertensive crisis. Next, 29th question. India has reduced infant mortality rate from 57 per 1000 live births in 2006 to dash in 2017. India has reduced infant mortality rate from 57 per 1000 live births to live birth in 2006 to dash in 2017. Correct answer, 33 per 1000 labors. Infant mortality reduced to 33 per 1000 live birth in 2070. Again, it is reduced it into 30 in 2019. Infant mortality reduced into 30 in 2019. What is the target of maternal mortality ratio by 2030? Correct answer 70 per 1 lakh live births. The target maternal mortality ratio at by 2030, that is 70 per 1 lakh live births. Then next question, identify the equipments. Correct answer is laryngeal mask airway or LMA. Next question, identify the condition shown in ECG. Correct answer is ventricular tachycardia. Next question, what is the normal range of blood sugar that a patient must have to prevent spread of infection? So in this, correct answer is 90 to 100. 90 to 100, that is in normal range. So it should be maintained during the hospitalization to prevent the spread of infection. If blood glucose level is more than a normal range, means it will be a good medium for growing the microorganisms. So that is why it is the glucose level should be keep in normal range. Next question, a sick child is brought to the emergency department and screening process done. This is called screening, triage, management, none of this. Correct answer, triage. Triage is the process of rapidly screening sick children soon after their arrival in hospital, in order to identify those with emergency signs who require immediate emergency treatment. So the triage is the process of rapidly screening sick children soon after their arrival in hospital in order to identify those with emergency signs who require immediate emergency treatment. Next question, the evaluation that needs to be done before giving ECT. Otoscopy, fluoroscopy, fundoscopy, laryngoscopy. Correct answer is laryngoscopy. So in ECT, there is a chance of giving, in ECT, usually anesthesia will, muscle relaxant anesthesia will be given. So before that, we should assess the larynx of the patient, because any problem or tumor or any anything is there that blocks the airway. So that need to be assessed before ECT. And also one more thing is there, ECT is contraindicated in the myocardial infarction and increased ICP. So this also should be assessed before giving ECT. The absolute contraindication for ECT includes active myocardial infarction and increased ICP. So airway, that is laryngoscopy, need to be done. So there should be assessed for any increased ICP or active MI. Next question, for COPD conscious patient through which oxygen delivery method can be used? The correct answer is, for a prolonged use, longer time use, we can use nasal cannula. Usually COPD patient require 2 liters per minute oxygen, so that we can administer through nasal cannula. The use of nasal cannula is common for patients with chronic obstructive pulmonary disease. This is often patient choice, as cannulas allow them to eat, drink and speak, and are often more comfortable than mask when they are receiving oxygen for longer period of time. So nasal cannula provides comfort to the patient and it will allow eating, drinking, speaking. So it will provide more comfort to the patient for a prolonged use. 37th question, unspecified signs and symptoms to specific signs and symptoms in which stage? Prodromal stage, convalescent stage, illness stage, incubation period. Correct answer, prodromal stage. The stages of disease divided into 5 stages. First one is incubation period. In that, the entry of microorganisms occurs. Then there will be an unspecified symptoms will be there. Sometimes it will be a fever or sometimes body pain. Like that, unspecified symptoms will be there. Then the third stage, that is the maximum number of microorganisms multiplies in the body and provides particular specific symptoms of that particular disease. That occurs in illness stage. Then there is a our antibodies will be produced in our body against that particular microorganism. Then there is a decline in number of microorganisms that occurs in fourth stage. Stage name is decline stage. And then final stage, fifth stage is convalescent stage. So these are the 5 stages of disease. First one is incubation period. Next one is prodromal period. Third one is illness period. Then fourth one is decline period. Last and final one is convalescent period. 38th question. If nurse is giving potassium infusion to a client, which finding of ECG shows that to discontinue this action? Prominent U wave, tall and peak T wave, ST elevation, widened QT interval. So potassium infusion usually administered for hypokalemia. So if when it should stop, either the patient shows patient's blood report, that is should be the potassium is within normal level, or the nurse should stop immediately if there is a signs of hyperkalemia. So here the hyperkalemia signs is tall and peak T wave. Hyperkalemia, if noticed in ECG, then the nurse should immediately discontinue the infusion. The prominent U wave, that is sign of hypokalemia. ST depression or narrowed QT interval also seen in hyperkalemia. ST depression and narrowed QT interval. Next question. How long does BCG last after reconstitution? How long does BCG last after reconstitution? Correct answer, 4 hours. After 4 hours, we need to discard the vaccine. 40th question. Which method is used for the delivery of after coming head in case of breech presentation? Correct answer, Burns-Marshall method. In the same time, low set maneuver, it is used for delivery of extended arms in case of breech presentation. Burns-Marshall method is used for head delivery of head. Same time, low set maneuver is used for the delivery of extended arms. Next question. Synonym of adept. Correct answer is expert, proficient, skilled, or skillful. Any of these option is there means you can make it. That is the correct answer. Then drug calculation. A normal saline solution of 2 liter to be administered to the patient within 24 hours. What will be the rate of administration in drops per milliliter? Drops per minute actually. If drop factor is 15. Correct answer is 21 drops per minute. So I will show you the solution. The total solution to be infused, that is 2 liter or 2000 milliliter. That is administered, the time duration that is given in hours. So 24 hours. So we need to make it in minutes. So multiply with 60. Our drop factor is 50 minutes. So after solving the 0, we can cancel here. And after solving this, 3000 divided by 144. That is equal to 20.83. That is, we can round it off and make it 21 drops per minute. Then, which one of the following is shockable rhythm? VT with pulse, assistole, pulseless VT, junctional rhythm. Correct answer is pulseless VT. The main 2 shockable rhythms are pulseless VT, that is unstable VT. Unstable VT and ventricular fibrillation. These are the 2 shockable rhythms. And assistole, there is no pulse, so it is not a shockable rhythm. We need to start CPR here, Junctional rhythm also not a shockable rhythm. VT with the pulse, that is a stable condition. It is also known as stable VT. So in this case, we can manage with the medicines. So pharmacological management only needed in the case of VT with the pulse and junctional rhythm. Assisted, we need to start CPR. So that is about memory based questions of JIPMER nursing exams. So thank you for watching this video. There will be changes. The questions, there will be changes with the actual questions. So I have made it with your given question memory based questions only. So kindly cooperate, and just I have prepared this video to make an idea of these questions. So if you have more questions, then please comment below the video. So thank you.